Welcome to the Healthcare Innovation Hub podcast. My name is Aisha, and this is
Franco Arias.
And we're really excited to be here with you today. Last week in our episode, we talked a little bit of what it was to be a small business in the U.S. And today we want to talk about gadgets that we can have at home around the healthcare industry. So home healthcare gadgets. And so I would like to first ask you, what does that mean? What does a home healthcare gadget, what is that?
Well, it's a device that can be used by any person at home with little training. There's some fundamental understanding that you need to have. For instance, a thermometer could be that. And then we'll probably talk about the other ones that have developed through the years. But it could be as small as a thermometer.
Okay. So yeah, I think the first thing and the most simplest thing is a thermometer, and maybe the most prevalent as well. But I think even as you go to CVS or Walgreens, and not to mention online retail, maybe Walmart online or even Amazon, you see that there's so much more things or products being given or coming out every time. So what innovation are you seeing within the home healthcare gadget industry?
Well, let's just say first that there has been a trend in the industry, in the healthcare industry, and that we now call, and it's normal to call it that way, it's a home healthcare industry. That means that there is a patient at home that needs care. And so that usually happened before in a hospital or in an institution that had nurses, doctors, people that knew about treating a patient that will care for that patient. But obviously that becomes extremely expensive. So the home health care industry is now filling up a gap, a huge gap, where now patients can be treated at home. And so for that, there are companies that the whole concept of servicing, it's to the families that care for a patient at home. So they have beds, they have wheelchairs, walkers, all of that stuff. People that need to lift a patient, and so there are these patient lifts, and through the years, we have been a trend of getting, devices that are prior to that. So in other words, a patient, someone that, that has, problems with their glucose levels. And so now, and I would say now, it had been happening for many years, but now we have, glucometers like this one. It's so easy to have. It's some in some countries they give it away. It's free because the money is really on the strip, and so that's where they actually make money, not in the actual meter. But so everyone in many countries even need to get this, and so it's so this is for someone that could care for their glucose levels at home. So that's the latest trend, right? It's not new, of course, but someone that needs care at home, but it's not in a bed. And for that, we have an explosion of new products. That's really the innovation part that we also want to talk about today.
Yeah. So I think how you mentioned the idea of home healthcare gadgets has been around for a while. I'm a 90s kid, and so I remember seeing the TV and in between shows or movies, the regular infomercial, where there's different things that were, being marketed specifically for maybe senior citizens or people with different ailments, and how to help them move around their house or carry things better. I started to also see a trend that It's no longer just maybe the vulnerable ages, right, or vulnerable people groups. Usually there's lots of home healthcare gadgets for babies, right? So there's a lot. I have friends that are having kids, and so baby showers, being able to go in and see the registry list that they have. I'm getting all this exposure to all these things that I didn't know babies could have, right? Apart from a thermometer, but so many things to take care of them. And then there's also things for grandparents. But I feel like there's also been a trend of just targeting at all of us that are in between, all the people that maybe are not babies and are not senior citizens yet.
Right.
What are your thoughts on that?
Well, and that's the beauty of technology. So maybe the technology has always been there, but if the industry doesn't see a move towards things that could be used, they're not going to produce, what's needed. For instance, this is one important one. We're here, Sinopulse, and it's basically it has like a water reservoir here where you can put water, distilled water, with a little powder that comes with this machine, and then it's really a water pump. That's what it is, right? But it is designed in such a way that it comes with little pulses, so the water gets taken from here with that saline mixture through this tubing, and then if you have sinus and if you're heavily congested, this water goes, you put it right here, and then it goes through the whole system and it comes down here, right? From one nostril to another, and it really eases up all of that congestion and pain. And so that's for anyone that has sinus, from a kid, and then a youth person, anyone can use it. So that's the part that the industry have seen. Maybe again, this is a water pump. What's new about it? It's a water pump, but it's adjusted to a pressure that is good enough for the nostril to to be flushed. And so all those sorts of things that people are watching and seeing. Maybe people are now getting used to. They're not afraid of using these devices. Maybe 30, 50 years ago, people will just go to the hospital or visit a doctor to be treated for any of these things. And they will be afraid of using them, right? They will say, "Oh, meter, that's for the doctor." But now, they're seeing people using like the glucometer. So, my grandma is using it. And now maybe I can use something else, right? And so that's the thinking behind all of these new devices.
Do you think that COVID-19 had any impact in the home health care?
Absolutely. I think that history will put the COVID pandemic as a starting point for many new devices. Let's just talk about the oximeter, for instance, right? The pulse oximeter. It's something that you will put in your finger, and it will measure the saturated oxygen, right? And again, if you went into the internet, you'll find how to use it, right? That's the beauty of it, and it will tell you. At least that's how we use it, right? When we had COVID. And it was a measure of when to go to the hospital. So if it was in the 90s, we were okay. But if we will go, 89, we'll start to worry about it, right? 80, you need to go to the hospital. And so those things that you can't ask a doctor, because the doctor, they were busy doing other things. It's a huge help, right? Thank God. They were used by regular people. There was no restriction on using them. And so people started to find out and purchase them. At the beginning of the pandemic, they were really low in cost. As people started using them, they ran out. And so it was more expensive. But but it was still doable. So that's one example.
Yeah.
But I mean, there are numerous of other examples of self-care. You were bound at home, and so you were looking. Oh, I don't want to be another person, in the hospital. What do I do? And so people started to share information. Vitamin D, zinc, all of that stuff. People became more aware of what needed to happen, what you needed to do before even getting close to a hospital.
Yeah, and I think that the idea of home healthcare gadgets, I hope for me, when I think about COVID-19, really took a turn because apart from it being just the individual's responsibility or things that individuals needed. So, for example, if you have sinus, then you know that you need a sinus machine, right? Or if you have these different ailments, you know that you need those things to help you out, measure your glucose or measure any number of things or help with the treatment that you're receiving. But in COVID-19, it wasn't just up to the individual level. We also saw how in order for hospitals, clinics, or laboratories even, everything to just be decongested and to give priority treatment to those that really needed it, they needed to also release, kind of like delegate some of that caring for ourselves. And I mean, the idea of PCR testing at home, I don't know if that would have even been thought before for other viruses, going and getting tested at home. Like that kind of idea came out of this need of we're all going through this, and we have a system in place, but it's overwhelmed, and we can't keep having people come, and not only are we receiving those that are sick, but we're also receiving people that don't know, but they have some of the symptoms, and maybe they get tested. It happened a lot. They would go into places to get tested or to just get checked, and they didn't. The test would come out negative, but because the environment was full of it all over the place, because everyone else that was going was actually with the virus, you would leave and you ended up having it. So I think that's something also that I saw from the whole idea of the healthcare gadget industry, and it started to also be something that was even encouraged from the other side, from doctors, from hospitals, from the government, of saying, hey, these are good things for us to give to individuals to take care of themselves, to be checking up on themselves.
Absolutely, that's a breakthrough.
Yeah,
we had to count as that. There was from the general public, there was an understanding of how the health industry works. That hasn't changed. If you think about it, to become a doctor, it takes years, sometimes 10 years of training, studying and then medical school, the whole thing. So it's not easy to replace a doctor or ask the health industry to put more doctors from one year to another. It takes a whole generation practically, and so that is still truth about our system, no matter where it is, right? So there is this number of doctors and nurses that are available for this population, but before the pandemic, there wasn't a public understanding of what that was. And now we understand. And that's for the home healthcare industry, that is a breakthrough, because they don't have to educate people now. People are aware because they went through the pandemic. They realize now, there are things that I could use to take care of myself, at least to monitor, right? So now, they put now those patches, and to measure your glucose levels, and your doctor could have access to that data. And if you will allow that, and so, he can actually monitor your health through those patches. And that's amazing. That's really amazing. Maybe before the pandemic, people were a little bit more skeptical of using those things, but now they're more open.
Yeah.
Again, that's a breakthrough
Yeah.
because now the industry has that as a plus. People do not need to be convinced. They already have the understanding. And so I think that's an excellent point for the technology to develop faster now.
Yeah. Yeah. When you talk about technology, I'm thinking about two things. So we could talk about them, but well, first of all is the whole idea of the smartwatch, right? The
Absolutely.
intersection of now our phones, our smartphones, our watches, everything that's becoming smart, and our health, right? So smartwatches that not only give us incoming calls and texts or whatever, but are also monitoring our heart rate. They're monitoring if we are running, if we're walking, how much exercise we're doing, how many calories we're burning, the ways that we're taking care of our
Right.
body, right? And then apart from that, another tech thing that I'm in the same sense is the whole telehealth system, right? So being able to call or have an appointment online with a doctor at a hospital or with your own doctor, and just receiving help and even prescriptions through that medium.
That's a huge plus. I mean, who loves waiting in the waiting room of a doctor's office? 1 hour, and no one wants that.
No.
And as you said, when you go to the doctor's office, there are people that are sick, and you go there together with them, and you catch whatever they have. Now, as you said, telemedicine. Oh, that's absolutely fantastic. You make a schedule appointment, and you have, what do you wait? Not even a minute or two, and you get connected to that person. Yeah, that part of the whole system, I think it's really a big improvement, and something that new generations are open to. Let's just talk about, for instance, what you just mentioned, the smartwatches, right? Generating your personal health data on a minute by minute basis. I mean, that's a tremendous amount of data. And so now if we add the AI concept to it, and so easily, an AI program or device could take your personal data, and analyze it through a month, through 3 months, and gives you projections, or your doctors, give a projection of your health, given the data that you have, because there is no way, unless you are under a research study, that you sleep and eat in a health facility for 3 months, that you're going to get that data, right? But now it's accessible. And let's face it, doctors don't have the time, unless you're in research, right, to do that kind of analysis. So just couple that information that the smartwatches are gathering with AI, right, and all the information that is being generated. That's a big thing. That's what's coming. It's already happening for that industry. We don't see it yet, right? But again, it's going to be something that we're all going to benefit, right? Now, what is it for all of us, the general public? Well, maybe tomorrow we'll have another one of these devices that will generate a whole analysis of our health easily, right? And now we have to do scans, right? Blood tests, a number of things. But maybe this device, with a scan and with your personal data, will be able to generate a diagnosis, right? Is it dangerous? We don't know. People were scared of that before, but now with all that, the information technology, I think it's doable, and if it's backed up by, institutions that are well known, right? Doctors, people that know what to see in a health report, I think is doable. It will accelerate the care for patients in the future, definitely.
Yeah. Wow. Very interesting conversations that we're having. We have on the table different home healthcare gadgets, but I believe we still haven't talked about this one.
Yeah.
Want to?
So this is a nebulizer.
Okay.
Moms, I mean, this is what you need, right? Because when your kids are coughing and coughing, this is probably the most useful thing. I know in other countries they had to go to a hospital to get access to a nebulizer, but it's basically, again, it's a device that will generate compressed air, right? It's an air compressor. But it's not just any air compressor, right? I mean, it has to be generating a compressed air in a way that will, any liquid within the chamber where it's connected will be a mist, a certain particle size that will go in through the system through the nose, and it will help the lungs and the whole respiratory system. There are certain drugs that are administered through a nebulizer, not necessarily, the regular saline solution with, the stuff that will clear out your nose, and when you have a cold, especially kids. But there are other drugs that are administered that are shown to be much better than the digestive system, but through the respiratory system. And so COVID-19, the pandemic, there were doctors that used the nebulizer for those drugs that were not developed for COVID-19, but they were developed for something else. But they were shown to the COVID patients. So again, things that were there, accessible to everyone, now they could be used for something really specific, like, treating COVID-19 patient, right? So that's a nebulizer. There, for moms that care, there are other models that have little like train models, like little colorful, for kids. Because sometimes the noise could be a little bit scary for little kids. But, I think that's the beauty of our healthcare industry, that it changes, it adapts, and they came with these designs, really, really cute designs for kids.
Yeah, I think that's also cute that for kids and also for babies, there's a lot of products that are made with their size thought out and the color and the design, so that it'll be friendly to them, and it's not such a scary experience.
Absolutely, yes.
That's good that the nebulizer also adapts to kids in that way. So maybe I would like to ask, what is one product out there that is really cool or innovative, and that you have maybe found in the recent year or a couple of years? I'll start off first.
Yeah.
So there's this product called the IQ Vision 2 Check. It's really cool. I haven't used it myself, so I can't talk about it from personal experience. But I did see a video and read a little bit about the product in itself, and it's really interesting because it's kind of this appliance, like a set of goggles maybe that you put on your phone, and it helps you go monitor and do this monitoring of your vision on your own at home. I myself have used glasses since I was 4 years old. We recently had laser eye surgery, which I'm really thankful for. And so now I don't have to use glasses, but it's been a long time of using glasses. And there's a period in my life where we had to go 2 times a year to the doctor, just because my eyesight was deteriorating pretty quickly. And when I saw this product, I was like, oh, this is perfect for people that are maybe going through something similar. And, it's something that at least you could use to see how your eyesight is going. It doesn't replace going to the doctor, because going to get your eyes checked is so much more than just seeing if you can see at a certain distance or if you can see colors. It's more than that, but it's a good way to be able to monitor yourself or monitor someone in your family, and you can even share those results with your doctor, and all very convenient with the use of your phone. They even provide like some kind of training or videos to help you use the product, so that's not so weird. I mean, either way, it's really self-explanatory. But those kind of things I saw, and I was like, wow, this is pretty cool and really innovative.
So there are certain things that are definitely a plus. The hyperbaric chamber is one of them. I think that I've seen more and more in the health fairs, the medical fairs, that this product is showing more and more in companies advertising and selling this product. Basically, the hyperbaric chamber is a chamber that will administer you oxygen at a higher pressure, and so why is it so important and it's so good? It's not harmful to the health. It's really beneficial. It has always been used by certain people, like scuba divers, and for years. That's when someone mentioned hyperbaric chamber, it was like, oh yeah, it's a diver, right? But more and more we have learned the benefit for regular people, right? Athletes use it more and more, showing in studies that if you are a diabetic, and you are because a diabetic will have difficulties healing for their wounds. And so hyperbaric chambers are an excellent tool to improve that process of healing because of the oxygen, right? And so there are some people that are working with hyperbaric chambers with cancer patients, right? There are studies, there are people that are experts that are working with that because the cancer cells survive in the abundance of sugar and the not so abundance of oxygen, and so there is a logic to it, So I think that hyperbaric chambers in the home is happening already. An institutional hyperbaric chamber is costly, it's huge. And, who is going to use it, right? And, and you had to have a doctor. Now there are hyperbaric chambers for home use. So, I think that that's one of the products I personally would like to try on a daily basis. I know for sure, this has been used for many, many years, and there's data about it. So I know for sure it's going to be good for my health, right? So that's one thing.
Yeah, and hyperbaric chambers were still being used a lot within veterans. So veterans that come back from war or from different tours, and either have been exposed to chemicals in the fields or have difficulty healing from different wounds. The hyperbaric chamber is often mentioned and used in their treatments. So it's interesting that now they're also being used in the home level, and that there's hyperbaric chambers that are made for home use. So very interesting. Well, thank you so much for having this conversation. This was a lot of fun to just share ideas. And if you that are listening have any other gadgets at home that you use or that you've heard of and that weren't mentioned, please put it in the comments. We'd love to continue exploring and seeing what other home healthcare gadgets there are and the ways that they're impacting the healthcare industry, and also the way that we associate ourselves with healthcare. So thank you so much for listening, and we'll be seeing you, or you're going to be hearing from us next week.